equipment is a major part of healthcare delivery, but here at the Tafo Government Hospital, there is a deficit. Over here, there are no beds, with buildings stalled. It is a bedless and burdened situation for the hospital, as they are unable to provide quality healthcare for patients who need them. Today, we are in the Tafo Government Hospital to look at the critical situation that patients go through and the major needs of the hospital itself. The corridors of the Tafo Government Hospital in the old Tafo municipality are narrow and crowded, with patients, relatives and medical staff jostling for space. As you step into the hospital, the sounds of desperation fill the air. Patients struggling for space, some on makeshift beds, others forced to sit or stand, waiting for attention from the overworked medical staff. This is the neonatal unit of the Tafo Government Hospital, and where I am standing it's very difficult to be in the midst of about 5 children and the nurses who are in here taking care of them in such a small building, and the congestion over here, you can really feel it when you enter. The room, they say, feels very hot with their air conditions even not operating. But this is the situation that they go through even in the neonatal unit of such a big hospital for a municipality.
It's really sad, I'll say that, because when we come and the place is choked like that, we find it so difficult to work. And currently, someone came to donate certain equipment to us, and then with the equipment, because of the place, we can't exhibit it or we can't use it at the moment unless we get a bigger place. So we are appealing to, I'll say, donors and then other philanthropists to come and help us.
The hospital's congestion is not a new phenomenon, but it has worsened in recent years. The patient's population has grown exponentially, while the hospital's infrastructure has remained stagnant. Medical Superintendent Dr. Eric Kwamedetu bemoans the infrastructural deficit of the hospital.
Tafo Government Hospital is very old, but infrastructurally, if you ask me personally, I will not call it a hospital. Infrastructurally, if you ask me personally, I will not call it a hospital. We need to do something about the infrastructure. It is the old structures that we are still having. Whilst it was urban health center, in those days it was called Tafo Urban Health Center. But once it was changed to a government hospital, the infrastructure still remains the same. So we have a problem with space.
According to Dr. Kwamedetu, the congestion of the hospital forces them not to admit some patients.
It's very serious. If you go to our labor ward, we have 6 beds. You go to our lying-in ward, postnatal, we have 6 beds. Then we have lying-in ward where women who are pregnant and they have medical conditions like malaria, pneumonia, we admit them. They also have only 5 beds. So when you add 6 in the labor ward, 6 in the postnatal, and 6 in the prenatal, we have only 18 beds that is available for pregnant women and people who need space when it comes to maternal issues. And Tafo Government Hospital is in the municipality, and it affects us in terms of the base. So sometimes you need to turn some of the people away because you can't admit all of them. Then you have a huge number also attending the ANC clinic, and it's done in a corridor where we have used TNJ to demarcate a consulting room for the midwives.
The maternity block, which was intended to provide a safe and comfortable space for expected mothers, has been under construction for 23 years with no end in sight. Dr. Kwamedetu says the stalled project has become a worry as its old block is deprived of space.
Since 2002, that is almost 23 years now, the project have not seen completion. So it's affecting the quality of care we are providing in the hospital. As we speak now, our ANC is being provided in a small area. Our maternity labor ward is very small, very small. So we keep on moving patients rapidly than they should. And because of this, it's also affecting the space the hospital needs to provide other things. So when you come to the hospital, it is not only the maternity that is small, the other wards are very small.
Patients and their relatives are also calling for help, frustrated by the lack of progress and the poor conditions at the hospital.
Congestion, yes. I stood up the whole of yesterday night. I didn't sleep. The bed is not enough for my baby and myself. So it's either this boy fell yesterday night because the bed is very little. The spaces, we can't even get places to keep our staffs. We have to keep our bags on the bed. So it's obvious. You can see for yourself. It is not comfortable. We are just managing and coping.
Small, ye buy same. And tuntumu re-esa obi ameba yarea. Na me expect say mira say me say tuntum ni ha say. Ade san awo mu a woni me wo so find den this so. And tuntum marry esa me kwa me tie me yampo. Just marry wo kan so ko ka champion no.
The 23-year-old maternity block stands as a testament to the failure of the healthcare system, a reminder of the work that needs to be done to provide quality care to patients. This is the Tafo Government Hospital's maternity block. After 23 years, this building is still stored and not completed. It was started to ease the burden on the old block, which is very small to accommodate patients. Now, after so many years, this building has now turned into a hideout for hooligans, weeds growing all over the building, and the frontage now turned into a refuse dump. The workers have named this place the first national cathedral, perhaps in the Ashanti region, because it was started 23 years ago, older than the new National Cathedral building that is equally stored in Accra. They want government to fasten the completion of this block to ease the burden on the old block. For Joe News, my name is Nana Boachidanko Yadom, Kumasi.